Assalamualaikum. How are you? Today I will present my paper titled Key Factors of Supportive Contemporary Community Needs for Mosque Facility. This paper is part of my PhD research. This is my second paper. It's a review paper. So my presentation will comprise of introduction, method, result, and results, proposed conceptual framework, and conclusion. Okay. As introduction, a new societal expectation idealized that malls should accommodate the needs of all communities, including men, women, children, youth, elderly, people with disability, the poor and destitute, non-Muslim, and others. This idea was inspired by the Prophet Mosque in Medina during the time of the Prophet, peace be upon him. Furthermore, mosque is a community-based building for the people, thus it should provide conducive space for users through effective physical, environmental, and functional performance criteria. However, within performance criteria alone is insufficient to fulfill the multi-dimension of human needs on mosque institution. Human aspect is also an important factor that influence mosque attendance, which include politics, secularization, and sickness. There is evidence that mosque attendance can be revived by providing good facilities that meet community needs, as demonstrated in a longitudinal study by Melipan. Their initial study reported a decline in mosque attendance due to secularization among the early Muslims of Turkish and Moroccan descent in the Netherlands. However, their latest study reported an increase in mosque attendance among the new generation Muslim because they live in co-ethnic neighborhoods who frequently visit the mosque. Hence, the purpose of this paper is to review past study and synergize related studies related to contemporary community needs on mosque facility. This paper also determined from past study three core components of mosque facility, which are religious space, social space, and public amenities. The main research question of this paper is, what is the need of community on mosque facility that meet their contemporary needs? So the method used, there are basically two main methods. The first is to conduct literature review synthesis process, where topic were identified using research question technique developed by Ibrahim, and then categorize RQ construct categorization technique for identifying three different RQ construct that consists of who, what, how construct in order to formulate the main research question which was presented earlier. This is followed by the second stage, which is article identified through Web of Science and Google Scholar using keyword on community needs, contemporary community needs, and Muslim community needs, and contemporary Muslim community needs for journal article published from Science and Social Science Citation Index dated 2017 to 2022. In separate search, written around 1,461 articles. Then the third stage, a total of 44 papers were initially selected according to their direct relevance to the topic. This article were then further reviewed according to the three themes. Okay. Finally, the author ended up with 31 articles, 14 for physical needs, 10 for social needs, and 7 for spiritual intelligence needs. The second method is to develop point of departure tree diagram, meaning from the result from the first step mentioned earlier, were categorized into three categories, which is physical needs, social needs, and spiritual intelligence needs. And the main construct is contemporary community needs. As the result was, from these three categorization of themes were then cross-analyzed to integrate possibilities and prioritize and the synthesized information to gear towards high probable solution that could improve the management of mosque facility in order to attract community to the mosque. Okay. Finally, a theoretical framework for contemporary community-centric mosque was developed as the outcome of this paper. So this is the first result on physical needs of community, which is comprised of two categories. The first is physiological needs, which relates to primary survival needs. The second category is safety needs, which comprise of crime prevention and disaster management and health services. Under crime prevention and disaster management, there are two factors, which is community policing and temporary evacuation shelter, while under health services you can see there's under public health and community health. Public health related to infectious disease, while community health related to chronic disease, reproduction health, mental health, palliative and geriatric care. The second result is on social needs of community. Social needs can be categorized into two. The first is social support, which comprises of pandemic and vulnerable group. Pandemic is related to mutual aid services and stress coping, while vulnerable group are, for example, PASADI indicate protected children and minority youth and Muslim women. Under community engagement, there are three factors, which are group, agency, and institution. Group relates to youth group. Agency relate to private public agency and emergency preparedness agency. And institution relate to research institution. The result is on spiritual intelligence needs. Comprised of two categories. The first is cognitive needs, which are short-term program and long-term program. The second one is spiritual needs, which are comprised of religious needs, transcendence needs, and connected needs. So discussion on the result on point of departure on contemporary community needs. So what I discussed is securing physiological safety and social needs of community through collaboration, integration of various programs on social engagement and support, charity and safety and health are avenues for driving communities and their families to the mosque. Another discussion is uplifting cognitive, spiritual and social needs of community through collaboration, integration of various programs on social engagement and support, intellectual, religious, transcendence and connected experiences are ways to attract community to the mosque. And the third discussion is on securing physiological, safety, cognitive and spiritual needs of community by integrating various programs on charity, safety and health and intellectual, religious, transcendent and connected experience in mosque are solution for attracting community to the mosque. For the discussion on point of departure on contemporary community needs are these two discussions. The first one is on securing physical, social and spiritual intelligence needs of community through collaborative and integrative programs on social engagement and support, charity, safety and health, intellectual, religious, transcendent and connective connection are avenues for driving community to the mosque. Second is comprehensive and contemporary needs on physical, social, intellectual and spiritual programs that collaborates and integrates visitors and community to the mosque. So this is the point of departure tree diagram for comprehensive contemporary community needs dimension for supportive mosque facility. As conclusion, the development of conceptual model for contemporary community-centric mosque facility. So you can see mosque building performance comprise on the bottom part, mosque building performance comprise of physical performance, environmental performance and functional performance. Okay, this will support contemporary community needs on physical, social, and spiritual intelligence needs, which will attract community to the mosque through mosque performance. As implication and recommendation, the study provides potential foundation for the development of future community-centric mosque facility guidelines that can guide architects and facility managers in designing and refurbishing mosques. Finally, the study recommends for the development of a framework for community-centric mosque performance through the integration of the output from mosque performance. Uh, Thank you for listening.